Good morning, good afternoon, good evening, good day, everyone. I am student nurse Wanda Lapides, and I am here to discuss to you about leukopenia and its two classifications, the neutropenia and the lymphopenia. Your blood is made up of red blood cell, white blood cells, platelets, and plasma. White blood cells are also called leukocytes. They account for only about 1% of your blood, but their impact is big. They protect you against illness and disease. Think of white blood cells as your immunity cells. In a sense, they are always at war. They flow through your bloodstream to fight viruses, bacteria, and other foreign invaders that threaten your health. When your body is in distress and a particular area is under attack, white blood cells rush in to help destroy the harmful substance and prevent illness. White blood cells are made in the bone marrow. They are stored in your blood and lymph tissues. Because some white blood cells have a short life of 1 to 3 days, your bone marrow is always making them. There are types of white blood cells. Monocytes. They have longer lifespan than many white blood cells and help to break down bacteria. Lymphocytes. They create antibodies to fight against the bacteria, viruses, and other potentially harmful invaders. Neutrophils. They kill and digest the bacteria and fungi. They are the most numerous type of white blood cell and your first line of defense when infection strikes. Basophils. These small cells seem to sound an alarm when infectious agents invade your blood. They secrete chemicals such as histamine, which is a marker of allergic disease that help control the body's immune response. Eosinophils. They attack and kill parasites and cancer cells and help with allergic response. White blood cell count can be low for a number of reasons. This includes when something is destroying the cells more quickly than the body can replenish them, or when the bone marrow stops making enough white blood cells to keep your body healthy. When your white blood cell count is low, you're at greater risk for any illness or infection, which can spiral into a serious health threat. A number of diseases and conditions may affect white blood cell levels. Weak immune system. This is often caused by illnesses such as HIV or AIDS or by cancer treatment. Cancer treatments such as chemotherapy or radiation therapy can destroy white blood cells and leave you at risk for infection. Second is infection. Higher than normal white blood cell count usually means you have some type of infection. White blood cells are multiplying to destroy the bacteria. Myelodysplastic syndrome. This condition causes abnormal production of blood cells. This includes white blood cells in the bone marrow. Cancer of the blood. Cancers, including leukemia and lymphoma, can cause uncontrolled growth of an abnormal type of blood cell in the bone marrow. This results in a greatly increased risk for infection or serious bleeding. Myeloproliferative disorder. This disorder refers to various conditions that trigger the excessive production of immature blood cells. This can result in an unhealthy balance of all types of blood cells in the bone marrow and too many or too few white blood cells in blood. Normal reference range. These are the normal reference range. The white blood cell count should at least within this range of number. And this is a differential white cell count. Neutrophils should at least within the range of these numbers, as well as the lymphocytes, the monocytes, the eosinophils, and the basophils. Have a normal white blood cell count or the differential white cell count. Person should have at least the number within these ranges. Leukopenia. Leukopenia is a condition where a person has fewer white blood cells in their bloodstream. Leukopenia is an umbrella term that refers to a reduction in any of the white blood cell types. Leukopenia is diagnosed with a blood test called a complete blood count or CBC. There are several medical conditions that cause leukopenia by interfering with the production of white blood cells in the bone marrow. Other conditions cause leukopenia by destroying white blood cells rather than affecting their production. Leukopenia may be also the result of some treatments and medications. These conditions that cause leukopenia are viral infections. This includes acute viral infections such as colds and influenza may lead to temporary leukopenia. In short term, a viral infection may disrupt the production of white blood cells in a person's bone marrow. Blood cell and bone marrow conditions. This can lead to leukopenia. Examples include aplastic anemia, overactive spleen, and myelodysplastic syndromes. Cancer. Leukemia and other cancers may damage the bone marrow and lead to leukopenia. Infectious diseases. HIV, AIDS, and tuberculosis. These infectious diseases can lead to leukopenia. Autoimmune disorders. Some of these kill white blood cells. Examples include lupus and rheumatoid arthritis. Birth disorders, also known as congenital disorders. Examples are Costman syndrome and myelokathesics. Malnutrition. Certain vitamin and mineral deficiencies may lead to leukopenia. Examples include deficiencies in vitamin B12, folate, copper, and zinc. Sarcoidosis. This is an overreaction of the immune system that leads to small areas of inflammation in the body. It can also affect bone marrow. Treatments and medications that may cause leukopenia. Cancer treatments may affect a person's white blood cell count, leading to leukopenia. This may include chemotherapy, radiation therapy, and bone marrow transplant. There are also certain medications that can affect the number of white blood cells in someone's blood, and this may lead to leukopenia. First is the interferons that is used to treat multiple sclerosis, lamotrigine and sodium valproate for epilepsy and as mood stabilizers, bupropion, an antidepressant and smoking cessation medication, clozapine, an antipsychotic medication, minocycline, a common antibiotic, immunosuppressants such as sirolimus, mycophenolate mofetil, tacrolimus, and cyclosporine, steroids, and penicillin. Pathophysiology. It starts with the precipitating factors that include exposure to radiation and certain chemicals, a person with leukemia, and HIV virus. This can affect in the somatic mutations in DNA, which causes to activate oncogene or may deactivate tumor suppressor gene. This can cause malignant transformation of lymphoid stem cells and can cause uncontrolled proliferation of lymphoblasts in the bone marrow, which leads to lymphoblasts to replace the normal marrow element that causes or that decreases the production of normal blood cells that leads to leukopenia, which is a decreased white blood cells, and a person may have a greater risk of developing infection because of the decreased white blood cells. There are no specific symptoms of having a low white blood cell count. However, when someone has leukopenia, they are more likely to get infections and may have the symptoms of infections, which include fever, sweating, and chills. A person with leukopenia may have other symptoms that relate to the cause of their low white blood cell. Treatments. The treatments for leukopenia is usually based on the specific cause of the disorder. If a medication is causing leukopenia, a doctor might recommend that the person stops taking it or tries a different type. A person should never stop or change their medication without first consulting a doctor. If a person has cancer and their chemotherapy is causing leukopenia, they may need to interrupt their treatment to allow their white blood cells to replenish. Treatments that use growth factors such as granulocyte colony stimulating factor that may help in treating leukopenia. These are often used when chemotherapy is causing leukopenia or if the cause is genetic. Home treatments and behaviors. The following home treatments and behaviors may help a person with leukopenia improve their condition and reduce their risk of infection by eating a healthy diet, getting a plenty of rest, avoiding cuts and scrapes, and practicing good hygiene to avoid germs. Treatment may also be needed for any infections that result from a reduced white blood cell count. This might include antibiotics and antifungals. Neutropenia. Neutropenia is an abnormally low number of neutrophils, which is a type of white blood cell in the blood. Neutropenia, if severe, significantly increases the risk of life-threatening infection. Neutropenia is often a side effect of the treatment of cancer with chemotherapy or radiation therapy. The typical lower limit of the neutrophil count is about 1,500 cells per microliter of blood. As the count goes below this level, the risk of infection increases. Neutropenia severity is classified as mild with 1,000 to 1,500 per microliter, the moderate with 500 to 1,000 per microliter, and severe with below 500 per microliter. When the neutrophil count falls below 500 cells per microliter, the risk of infection increases greatly. People may even develop infections by the bacteria that normally live harmlessly in the mouth and intestines. Neutropenia has many causes, but they fall into two main categories. Neutrophils are used up or destroyed faster than the bone marrow can produce new ones. Rapid use or destruction of neutrophils may be caused by disorders that include certain bacterial infections, some allergic disorders, and some drug treatments such as drugs used to treat hyperthyroidism. People with autoimmune disorders can make antibodies to destroy neutrophils and result in neutropenia. People with an enlarged spleen may have a low neutrophil count because the enlarged spleen traps and destroys neutrophils. Production of neutrophils in the bone marrow can be reduced by cancer, viral infections such as influenza, bacterial infections such as tuberculosis, myelofibrosis, or deficiencies of vitamin B12 or folate or folic acid. People who have received radiation therapy that involves the bone marrow may also develop neutropenia. Many drugs, including phenothiazine, sulfur drugs, and many drugs used in cancer treatment or the chemotherapy, as well as certain toxins like benzene and insecticides, can also impair the bone marrow's ability to produce neutrophils. Production of neutrophils in the bone marrow is also affected by a disorder called aplastic anemia, in which the bone marrow may shut down production of all blood cells. Certain rare hereditary disorders can also cause a decrease in the number of neutrophils. In cyclic neutropenia, the number of neutrophils rises and falls regularly over a period of weeks. In chronic benign neutropenia, neutrophil counts are low but infections are rare, probably because people produce adequate numbers in response to infection. Severe congenital neutropenia is a group of disorders that prevent neutrophils from becoming mature, and people develop serious infections starting in infancy. Neutropenia itself has no specific symptoms, so it is usually diagnosed when an infection occurs. People may develop fever and painful sores or ulcers around the mouth and anus. Bacterial pneumonia and other severe infections can also occur. In chronic neutropenia, people may not have many symptoms if the number of neutrophils is not extremely low. When neutropenia is caused by drugs, people may have fever, rash, and swollen lymph nodes. In cyclic neutropenia, people can have symptoms that come and go as their white blood cell count rises and falls over time. Because neutropenia has no specific symptoms, doctors often do not suspect the disorders unless people have frequent or unusual infections. Diagnosis. Neutropenia can be diagnosed with the use of complete blood count and bone marrow examination. When people have frequent or unusual infections, or if people are taking drugs known to cause neutropenia, doctors order a blood test, which is a complete blood count, to make the diagnosis. A low neutrophil count indicates neutropenia. In many cases, the neutropenia is expected and the case is known, as in people receiving chemotherapy or radiation therapy. When the cause is not known, it must be determined. Whether the cause is known or not, doctors usually also search for a hidden infection that may have been caused by the neutropenia. Determination of the cause. Doctors ask about drug or toxic exposures and look for infections or other disorders that can cause the neutropenia. They frequently take a sample of bone marrow through a needle. The bone marrow sample is examined under a microscope to determine whether it looks normal, has a normal number of neutrophil stem cells, and shows normal development of neutrophils. By determining whether the number of stem cells is decreased and whether the cells are maturing normally, doctors may be able to determine whether the problem lies in faulty production of the cells or whether too many cells are being used or destroyed in the blood. Sometimes the bone marrow examination indicates other diseases, such as leukemia or other cancers, or infections such as tuberculosis that are affecting the bone marrow. If a hereditary disorder is suspected, doctors may go genetic testing. Evaluation for infection. Because people with neutropenia might not have all the typical symptoms and examination findings of an infection, doctors ask people detailed questions about their symptoms and examine them from head to toe. Tests are done for any concerning findings. For example, if the person has abdominal discomfort, computed tomography of the abdomen may be done. Even if no other symptoms are present, if the person has a fever, doctors typically also do urinalysis and urine culture, blood cultures, and a chest x-ray. When doctors do a culture, they take sample of the material being tested and send it to the laboratory to grow bacteria or other organisms that may be present. Medical management of neutropenia. The most important thing is to treat any infection that is found. In people with severe neutropenia, infections can rapidly become serious or fatal. Even if doctors cannot diagnose a specific infection, people who have neutropenia and fever are presumed to have an infection. Such people are given antibiotics, which is effective against common infectious organisms. Fever, the symptom that usually indicates infection in people who have neutropenia, is an important sign that immediate medical attention is needed. Drugs to stimulate production of neutrophils is also given. Growth factors called colony-stimulating factors, which stimulate the production of white blood cells by the bone marrow, are sometimes helpful and are given as an injection under the skin or into a vein. Corticosteroids may help if the neutropenia is caused by an autoimmune disorder. Anti-thymocyte globulin or other types of therapy that suppress the activity of the immune system may be given by vein when a disorder such as aplastic anemia is present. The treatment of neutropenia itself depends on its cause and severity. Drugs that may cause neutropenia are stopped whenever possible, and exposures to suspected toxins are avoided. Sometimes the bone marrow recovers by itself without treatment. The neutropenia accompanying viral infections such as influenza may be transient and resolve after the infection has cleared. People who have mild neutropenia generally have no symptoms and may not need treatment. People who have severe neutropenia can rapidly die as a result of infection because their bodies lacked the means to fight invading organisms. When these people develop infections, they are usually hospitalized and immediately given strong antibiotics even before the cause and exact location of the infection are identified. When neutropenia is caused by another disorder such as tuberculosis and leukemia or other cancers, treatment of the underlying disorder may resolve the neutropenia. Bone marrow or stem cell transplantation is not used to treat neutropenia per se, but it may be recommended to treat certain serious causes of neutropenia such as aplastic anemia or leukemia. Lymphopenia. Lymphopenia is also known as lymphocytopenia. It is an abnormally low number of lymphocytes, which is a type of white blood cell in the blood. Lymphocytes are a type of white blood cell that plays several roles in the immune system, including protection against bacteria, viruses, fungi, and parasites. A reduction in the number of lymphocytes may not cause a noticeable decrease in the total number of white blood cells. There are three types of lymphocytes: the B lymphocytes or B cells, T lymphocytes or T cells, and the natural killer cells or NK cells. All three types have important functions in the immune system. Too few B cells can lead to a decrease in the number of plasma cells, which produce antibodies. Decreased antibody production can cause an increase in bacterial infections. People who have too few T cells or too few natural killer cells have a problems controlling certain infections, especially viral, fungal, and parasitic infections. Severe lymphocyte deficiencies can result in uncontrolled infections that can be fatal. Classifications. Lymphocytopenia can be classified as acute and chronic. In acute, it occurs briefly during certain conditions and then usually resolving. In chronic, it occurs for a longer period because of long-lasting disorders. AIDS and undernutrition are the most common causes of chronic lymphocytopenia. Causes. There are various disorders and conditions, including infection with viruses such as human immunodeficiency virus or HIV, the virus that can cause AIDS, and the influenza virus can decrease the number of lymphocytes in the blood. Causes of acute lymphocytopenia. The number of lymphocytes can temporarily decrease during certain viral infections such as influenza and hepatitis, fasting, times of severe physical stress, use of corticosteroids such as prednisone, chemotherapy and/or radiation therapy for cancer. Causes of chronic lymphocytopenia. The number of lymphocytes can remain low for a long time when people have undernutrition, Certain autoimmune disorders, such as systemic lupus erythematosus or lupus, rheumatoid arthritis, and myasthenia gravis. Certain chronic infections, such as AIDS and military tuberculosis, certain cancers, such as leukemia and lymphomas. The number of lymphocytes may be very low permanently in certain hereditary immunodeficiency disorders such as the George syndrome, Wiskott-Aldrich syndrome, severe combined immune deficiency, and ataxia-telangiectasia. Symptoms: mild lymphocytopenia may cause no symptoms. Sometimes, symptoms of the condition that caused lymphocytopenia may be present. It includes enlarged lymph nodes and an enlarged spleen suggesting cancer or HIV infection. Cough, runny nose, and fever suggesting a respiratory viral infection. Small tonsils or lymph nodes suggesting an inherited immune system disorder, and painful swollen joints and a rash suggesting rheumatoid arthritis or systemic lupus erythematosus. Drastically reduced numbers of lymphocytes lead to repeated infections with bacteria, viruses, fungi, and parasites, and the symptoms of those infections, which vary widely according to the site of infection and the specific microorganism. Diagnosis. The disorder can be diagnosed through complete blood count. Mild lymphocytopenia is usually diagnosed by chance when a complete blood count is done for other reasons. Complete blood count testing is also done in people with recurrent or severe infections and in people with infections caused by organisms that do not usually cause infections. Such testing may show severe lymphocytopenia as an explanation for why the person has developed recurrent or unusual infections. When the number of lymphocytes is drastically reduced, doctors usually do a blood test for human immunodeficiency virus and other infections and sometimes take a sample of blood marrow to examine under a microscope, a procedure called bone marrow examination. The number of specific types of lymphocytes in the blood can also be determined. A decrease in certain types of lymphocytes may help doctors diagnose some disorders such as AIDS or certain hereditary immunodeficiency disorders. Treatment of lymphocytopenia depends mainly on the cause. Lymphocytopenia caused by a drug usually begins to resolve within days after a person stops taking the drug. If the lymphocytopenia is the result of AIDS, combination therapy with at least 3 antiviral drugs or different classes can increase the number of T cells and lengthen survival. Gamma globulin, a substance rich in antibodies, may be given to help prevent infections in people with too few B cells, who therefore have a deficiency of antibody production. People with a hereditary immunodeficiency disorder may benefit from stem cell transplantation. If an infection develops, a specific antibiotic, antifungal, antiviral, or antiparasitic drug directed against the infective organism is given. Nursing diagnosis. These are the possible nursing diagnoses for patients with reduced number of white blood cells. These include activity intolerance related to generalized body weakness secondary to decreased white blood cells as evidenced by restlessness, fatigue, and inability to do daily activities. Impaired physical mobility related to decreased strength and endurance secondary to chemotherapy as evidenced by limited ability to perform gross or fine motor skills. Risk for infection related to decreased white blood cells. Nursing management. minimize the risk of infection. Sterile hand washing should be observed by all personnel entering the patient's room and before any care episode. Neutropenic patients should be nursed away from infected patients. Special care should be taken during any invasive procedures. Observing for signs of infection. Vital signs is monitored every 4 hours if infection is present or suspected. Observed for hypotension, altered respiratory rate, tachycardia, skin inflammation, cough, or sore throat. Provide patient education and support. Nurse should ensure that patients and their families are able to take adequate precautions to prevent infections. Patients should be taught to record their own temperature with a 24-hour contact number for hematology unit. Advise maintaining a low microbial diet. The prognosis of leukopenia, neutropenia, and lymphopenia is good, but in small cases, it may lead to a life-threatening infection. Treating white blood cells disorder may involve pausing medication or treatments. This may be problematic if the underlying condition is serious, such as cancer, but doctors will help a person work around that condition. A doctor will regularly check a person's white blood cell count if they have a condition known to cause the disorder. Getting regular blood tests helps the disorder to be identified early and treated before it leads to life-threatening infection or other complications.